Gentlemen, I need you to pay very close attention right now because I already know what's running through your head. You saw this video title and you're thinking, Dr. Emily Carter, are you serious? My toothbrush? The same thing I use to clean my teeth every morning? I completely understand. It sounds totally ridiculous. It sounds like something from one of those bizarre internet rabbit holes. But I'm asking you to give me just 5 minutes of your time because that toothbrush currently sitting by your sink, it's not only for brushing your teeth. When you understand exactly how to use it, and I mean exactly, it becomes a tool for activating immediate blood flow, awakening dormant nerve pathways, and restoring the kind of firmness and responsiveness you may not have experienced in years. We're talking about a physical reaction that occurs in under 30 seconds. I'm dead serious. I'm not suggesting some strange pill, and I'm definitely not talking about cleaning your molars. There's a precise, hidden biological trigger point on the male body, a neurological gateway that nearly every man completely overlooks. When you stimulate it using the particular vibration pattern of a toothbrush, you're essentially tapping into your nervous system. You're manually flipping the switch that tells your brain, send blood here immediately. Now, my name is Dr. Emily Carter. I've dedicated the past 12 years in clinical medicine helping men reclaim their strength, their self-assurance, and their pride. What I'm about to reveal is grounded in human anatomy. It costs you absolutely nothing. And here's the incredible part. It delivers results the very first time you use it. But, and this is crucial, you must watch this entire video. There's an exact method here. If you touch the wrong location or apply incorrect pressure, you'll feel nothing at all. Or even worse, you might actually deaden the sensation. So put your phone face down, close those other browser windows, and focus. We're about to transform your life today, beginning with what's already in your bathroom. Before we jump into the anatomy lesson, do me a quick favor. Hit that subscribe button right now. I'm here to share honest truths about men's health that most people are too uncomfortable to discuss. And leave a comment below. I want to hear from you. Where in the world are you watching from? Drop your city or country in the comments. I absolutely love seeing our worldwide community. All right, let's get started. To grasp why a toothbrush, of all possible things, is the answer, we need to stop viewing the penis as simply a muscle or a sponge. We need to see it for what it truly is, an electrical device. Most men believe that erectile function is purely about blood circulation. You think, if my blood flow is good, everything's fine. And yes, that's partially accurate. But blood flow doesn't magically appear on its own. Your heart doesn't randomly choose to pump blood toward your pelvis. It requires a signal. It requires an instruction. Think about your vehicle. You can have a completely full gas tank. That's your blood supply. But if your spark plugs are dead or the wiring to your ignition is severed, that engine isn't turning over. It doesn't matter how much fuel you've got. For many men over 60, the real problem isn't the fuel itself, it's the electrical system. Here's the science that most physicians don't have time to break down for you during a rushed 15-minute appointment. Between your scrotum and your anus, there's a narrow strip of skin. It's usually forgotten. We call this the perineum. In common terms, some folks refer to it as the taint. You probably wash it in the shower and never give it a second thought. But from a biological standpoint, that tiny patch of skin is incredibly valuable territory. Located directly beneath that surface is the pudendal nerve. Now, if you remember only one thing from this entire video, remember that name, the pudendal nerve. This is your main highway. This is the communication cable that links your brain to your pelvic floor, your scrotum, and yes, your penis itself. This nerve controls sensation, muscular contraction, and ultimately the activation of erections. When you're aroused, this nerve transmits a message up your spinal cord to your brain announcing, "We're engaged." Your brain responds by dilating the blood vessels wide open. Here's where the trouble starts. As we get older, two things occur. First, we experience naturally reduced circulation. Second, and this is even more significant, we develop what I call neural sluggishness. That nerve becomes lazy. It loses sensitivity. Maybe you're sitting in an office chair 8 hours daily. Maybe you cycle regularly. Maybe you simply haven't activated that particular zone in ages. The signal weakens. It's like trying to tune into a radio station through heavy interference. Your brain can't clearly receive the message, so it doesn't release the blood. This is exactly where the toothbrush enters the picture. We know from research, particularly compelling research published in the Journal of Sexual Medicine, that perineal stimulation can activate a reflex response. But your fingers? They're typically too wide. They apply uneven pressure. They can't generate a steady rhythm. A toothbrush, specifically those bristles, produces a very particular texture. And when you use the technique I'm about to teach you, a targeted vibration, this vibration reactivates the pudendal nerve without overwhelming it. It eliminates the interference. It clarifies the connection. It broadcasts a strong, unmistakable signal to your brain commanding, "Engage now." It's biological optimization in its simplest form. Now, before I share the exact step-by-step method, I need to warn you about something. In my 12 years of clinical work, whenever I introduce a technique like this, I watch men jump straight into action. They get enthusiastic, they dash to the bathroom, they experiment, and they return telling me, "Dr. Carter, it didn't do anything." When I ask what they actually did, I discover they made one of 4 critical errors. These mistakes don't just prevent the technique from working, they can genuinely make your situation worse. Let's go through them so you avoid these pitfalls completely. Mistake number 4, the harder is better trap. Excessive force. This is by far the most widespread error. Men assume if gentle stimulation works, aggressive must work better. So they grab that toothbrush and start scrubbing their perineum like they're cleaning grease off a barbecue grill. Stop immediately. Please stop. The pudendal nerve is delicate. It runs just beneath the skin surface. If you push hard or scrub vigorously, you activate pain sensors, not pleasure sensors. Your nervous system shifts into protective mode. It restricts blood vessels. The complete opposite of our goal. We're seeking gentle stimulation, not aggressive scrubbing. Mistake number 3, the wrong equipment, stiff bristles. Go check your bathroom right now and examine your toothbrush. If the packaging reads firm or medium, absolutely do not use it for this method. The skin covering your perineum is considerably thinner than skin on your palms or back. Stiff bristles will feel rough and uncomfortable. Discomfort destroys arousal. It shuts down the parasympathetic response, which I'll explain shortly. You absolutely need a soft or extra soft bristle toothbrush. If you don't own one, purchase one today. It's a $1 investment for life-changing results. Mistake number 2, the endless session, incorrect timing. I've had patients admit they attempted this for 10 straight minutes. Gentlemen, 10 minutes is an eternity for a nerve response. If you continue too long, you exhaust the chemical messengers. You basically numb the nerve. The feeling becomes background static, like the constant hum of an air conditioner. You become desensitized to it. This technique works as a quick spark, not a slow burn. We need brief, concentrated bursts, 20 to 30 seconds maximum, that's all. Mistake number 1, the stressed approach, wrong mental state. This is the hidden destroyer of results. You cannot perform this technique while you're anxious about bills or wondering if you locked the front door or dwelling on joint pain. If your mind is stuck in stress mode, your sympathetic nervous system, your entire system floods with cortisol and adrenaline. Adrenaline is the absolute enemy of erections. It tightens blood vessels to redirect blood to your muscles for escaping threats. You could use the toothbrush flawlessly, but if your mind is racing with worries, the signal never reaches its destination. You must be mentally present. All right, you've got the proper mindset, you understand what to avoid. Now I'm going to guide you through the precise protocol. I want you to picture this clearly now so you can execute it perfectly later. This is the 30-second activation. Step 1, the preparation. Privacy matters enormously. You need complete relaxation. You can do this while standing or perched on the edge of a chair or closed toilet seat. You need comfortable access to your perineum. Step 2, finding the location. Using your hand without the toothbrush initially, reach down between your scrotum and anus. You're searching for that soft band of skin. It's roughly the diameter of a quarter. You may detect a slight ridge or just smooth tissue. That's your target area. That's where the pudendal nerve sits closest to the surface. Step 3, making contact. Take your clean, soft-bristled toothbrush. Make sure it's dry or slightly warm. Cold bristles can be jarring. Position the bristles gently against that spot. Don't apply pressure. I repeat, don't push down. Simply rest the bristles there so you sense the texture touching your skin. Step 4, the movement pattern. Here's where the magic happens. You're going to employ 2 specific movements. Movement A, the microcircle. Rotate the brush in extremely tiny circles, about the size of a pea, feather-light touches. Movement B, the gentle tap. Softly tap the bristles up and down against the skin. Switch between these 2 patterns. Circle for 5 seconds. Tap for 5 seconds. This alternation prevents the nerve from adapting or becoming accustomed to one sensation. It keeps the signal active and fresh. Step 5, the time frame. Count it precisely. 1, 2, 3, all the way to 30. While doing this, I want you to concentrate your full attention on that feeling. Close your eyes. Notice the bristles. Picture that electrical pathway illuminating. Imagine the signal racing upward to your brain and the blood rushing downward in response. Step 6, the timing window. This is absolutely critical. Perform this 2 to 5 minutes before intimate activity. This is a preparation technique. You're warming up the system. If you do this 30 minutes beforehand, the benefit will disappear. It must be done right before you require the performance. Now, if you stop watching here, you'll see results. Most men experience a tingling feeling, warmth spreading through the pelvis, or the beginning stirrings of an erection within those 30 seconds. But I want to give you the advanced strategy, the element that elevates this from an interesting trick to a genuine medical tool. You need to pair the toothbrush stimulation with deep belly breathing. Remember when I mentioned adrenaline destroys erections? Well, controlled breathing eliminates adrenaline. While you're performing the 30-second toothbrush technique, I want you to follow this breathing pattern. Breathe in through your nose for a count of 4. Deep into your lower belly, not your upper chest. Hold for a count of 2. Breathe out through your mouth for a count of 4. Why does this matter? When you breathe this way, you manually shift your nervous system from sympathetic stress mode to parasympathetic rest, digestion, and arousal mode. By synchronizing the physical stimulation from the toothbrush with the chemical calming from the breathing, you're addressing the problem from both angles simultaneously. The toothbrush awakens the nerve. The breathing quiets the mind to permit the blood to flow freely. It's a devastating 1-2 combination that eliminates erectile dysfunction symptoms in mild to moderate cases almost immediately. I want to pause here and speak to you directly, man to man, physician to patient. I realize that attempting something like this might feel embarrassing. I understand that struggling with erectile performance can make you feel defective. In my 12 years treating patients, I've witnessed the toughest men, business executives, tradesmen, veterans, break down crying in my examination room because they feel like they've lost part of their identity. They feel like their own body is working against them. They feel diminished. I want you to understand that those emotions are completely valid, but the interpretation is incorrect. You are not defective. You're simply changing. Your body at 60 or 70 isn't identical to what it was at 20, and that's perfectly acceptable. The wiring simply needs slightly more assistance. It requires a stronger signal. There's zero shame in understanding how your biology functions. There's zero shame in using whatever tool works, whether that's medication, a device, or yes, a toothbrush, to achieve the outcome you desire. The only real shame exists in abandoning yourself because you're too self-conscious to experiment. Intimacy is a magnificent aspect of human life. It bonds us with our partners. It lowers stress hormones. It benefits cardiovascular health. You absolutely deserve to experience that, regardless of how many candles are on your birthday cake. Using this method isn't strange. It's intelligent. It's mastering your own physiology. It's reclaiming power from the aging process. So here's your reality check. You can close this video, return to whatever you were doing, and change absolutely nothing. You can accept things as they are. You can resign yourself to the idea that performance just isn't what it once was. Or you can take decisive action. You can walk to your bathroom tonight. You can locate that soft bristle toothbrush. You can shut the door, take one deep breath, and invest 30 seconds in your own well-being. You have absolutely nothing to risk. It's completely free. It's perfectly safe. And research demonstrates that for many of you, it will be the catalyst that reignites everything. I want you to actually try this. Genuinely, try it tonight. And then I want you to return to this video. I want you to scroll down to the comment section and write simply, "It worked," or describe what you experienced. Because when you document your success, you provide hope to the countless other men reading those comments who are too afraid to speak up. You're not finished yet. Your vitality is still present, waiting for the correct signal. Go deliver that signal. If this video provided value, please click that like button. It helps this critical information reach the men who desperately need it. Subscribe to the channel so you catch our next exploration of men's health topics. I'm Dr. Emily Carter. Thank you for trusting me with your attention. Take excellent care of yourself, and I'll see you in the next one.